What if the first signs of a dementia didn't look like memory loss at all? What if they showed up as small everyday mistakes? Things you might easily dismiss as just getting older. The truth is, dementia often begins years before diagnosis, and catching these early warning signs could make all the difference. Dementia isn't a single disease, it's a group of conditions that affect memory, thinking, and social abilities severely, enough to interfere with daily life. But here's the critical part. Early detection can slow its progression, help maintain brain function, and improve quality of life. So, let's uncover 5 critical early signs your brain might be sending, and what you can do to protect it. We all forget things sometimes, but when memory lapses start interfering with the normal routines, like forgetting familiar routes, appointments, or repeating questions, that's an early red flag. This happens because of hippocampus, the brain region responsible for forming new memories, begins to deteriorate. Plaques and tangles, abnormal buildups of a protein like beta amyloid and tau, disrupts communication between neurons. If left unchecked, this damage spreads, leading to progressive memory decline and confusion. Early intervention with a cognitive therapy, a balanced diet, and physical activity can help preserve hippocampal health. Do you or someone you know struggle to find simple words mid-sentence or lose track of what's being said? This is another subtle sign. The brain's language centers, particularly in the left temporal and the frontal lobes, begin to lose efficiency. You might substitute incorrect words, pause often, or withdraw from conversations out of frustration. These changes aren't just senior moments. They signal early disruptions in the neural communication pathways, especially those tied to language processing and comprehension. If this happens frequently, it's important to seek medical advice. Early speech therapy and brain exercises can strengthen neural circuits. Dementia doesn't only affect memory, it can change personality and mood long before cognitive decline becomes obvious. Sudden irritability, anxiety, or apathy may occur because the prefrontal cortex and the limbic system, areas that regulate emotion, are affected early. These symptoms are often mistaken for depression, which delays proper diagnosis. Neuroinflammation and a chemical imbalance, especially reduced dopamine and serotonin activity, are the key drivers behind these mood-related changes. If you or someone close seems emotionally different for no clear reason, it may be their brain signal distress. If one simple task, like managing bills, cooking familiar recipes, appliances, suddenly feel confusing, this could indicate impaired executive function. The frontal lobe, which manages attention, problem solving, and organization, is one of the first areas impacted in the many types of dementia. This isn't about forgetting how to do something, it's about losing the ability to process steps logically or sustain focus. Ignoring these symptoms can lead to dangerous station, especially with driving or medication management. Recognizing these signs early allows for a lifestyle and environmental adjustments that makes daily living safer and less stressful. Have you noticed someone wearing inappropriate clothes for the weather, giving away money recklessly, or avoiding social contact? This loss of judgment comes from damage to the brain's orbitofrontal cortex, the center for decision making and impulse control. As neural deteriorates, irrational financial choices, or become socially isolated because they can't follow conversations or feel embarrassed. Left untreated, those behavioral changes accelerate cognitive decline and increase the risk of depression and loneliness. The earlier they're addressed, the better the chances of solving progression and maintaining independence. Stay physically active. Exercise increases blood flow to the brain and stimulates the release of a brain-derived neurotrophic factor, a protein that supports neuron growth and survival. Just 30 minutes of brisk walking 5 times a week can reduce dementia risk by up to 40%. Follow Mediterranean diet. This diet rich in olive oil, fish, whole grains, fruits, and vegetables provides antioxidant and omega-3 fatty acids that protect brain cells from oxidative stress. Research showed that people who closely follow this diet have a significantly lower risk of developing Alzheimer's and vascular dementia. Keep your brain challenged. Learning new skills, readings, or doing puzzles strengthen neural connections and promotes neuroplasticity. Even small activities like playing a musical instrument or learning a language can stimulate memory center and delay decline. Manage sleep and stress. Chronic sleep deprivation increases amyloid beta buildup, one of the key markers of Alzheimer's. Estrogen releases cortisol, which shrink the hippocampus over time. Practicing meditation, deep breathing, and maintaining consistent sleep routines can significantly reduce dementia risk. Check for vitamin deficiencies and manage chronic conditions. Deficiency in vitamin B12, D, and folate can mimic or worsen cognitive decline. Similarly, uncontrolled diabetes, high blood pressure, or high cholesterol increases the risk of vascular dementia. Regular blood tests and medical checkups can help identify and manage these hidden risk factors early. Dementia doesn't happen overnight. It's a slow process that can often be detected years before major memory loss begins. By recognizing these early signs and make small, consistent lifestyle changes, you can protect your brain, preserve your memories, and a live life with clarity and a purpose.